We know that patients with metabolic syndrome and diabetes are at higher risk. We know people with left ventricular ejection fraction dysfunction are certainly at higher risk. What about the value of LV mass for predicting CVD events in persons with METs or diabetes? That's the topic in a paper from JACC Imaging for September 2015. It's called Left Ventricular Mass as Predictor of Cardiovascular Disease Events in Older Adults with and Without Metabolic Syndrome and Diabetes. And I'm with Nathan Wong, UC Irvine, who is a doctor and a professor at UC Irvine and the director there of the UCI Heart Disease Prevention Program in their School of Medicine. First off, congratulations. I like this paper, and the reason I wanted to talk to you is we have too many patients with diabetes, we have too many patients with LV dysfunction, so what you're trying to do is check a new way of assessing risk in these patients. Why did you do the study at first?
Okay, well, thank you very much, Rick, for giving me an opportunity to discuss our study with you. Well, I think as you said, we certainly all know that people who have diabetes and metabolic syndrome are generally at higher risk. However, there's a wide variation in risk we're certainly aware of, and it's now becoming more and more obvious, for example, that diabetes is not always a coronary heart disease risk equivalent, and many times it is not. So a lot of our work has focused on looking at various imaging strategies to help stratify risk in people who have diabetes and metabolic syndrome, and to try to identify people who may be at actually highest risk. So what we did in this study is that we looked at individuals from the actually cardiovascular health study, which is a long-term prospective study of cardiovascular disease.
It's a classic.
In actually older adults, 65 and over, studied since around 1990, and we had echocardiography data, and actually specifically 2D directed M-mode measures of left ventricular mass as well as dimensions in these individuals. Now, we certainly know from other studies that people who have diabetes have actually higher levels of left ventricular mass. And in fact, in our study, they had LV mass actually measures that were about 20 grams greater than those actually without diabetes. But we haven't established from earlier studies whether left ventricular mass is of similar prognostic significance in people with and without diabetes or metabolic syndrome. So
you've got about 3,724 patients, I think, in this, and you kind of look at them through, so there's a group that has metabolic syndrome, diabetes, and then just a regular group that has neither?
Right, exactly, yeah. So we divided individuals into those who had diabetes, those with metabolic syndrome without diabetes, and those who had actually neither of these conditions. And then we used certain statistical techniques, mainly Cox proportional hazards regression analysis, to look at the relationship of actually various measures of left ventricular mass. And so actually not just LV mass by itself, but also LV mass indexed, for example, to actually height to the actually 1.7 power, for example, as well as LV mass index to actually body surface area. And we basically found that that it offered both modest and statistically significant predictive value, even over and above standard risk factors in people who had neither condition, as well as people who had metabolic syndrome but without diabetes, but surprisingly, no relationship in people who had diabetes. So,
do you have any idea why?
Well, I think we've certainly always been aware that individuals who have diabetes have a much greater baseline risk of cardiovascular disease, and they tend to have a greater burden of other cardiovascular risk factors. So while we found that there was a modest relationship in actually unadjusted analysis, when we adjusted for these other risk factors that tend to be more significant in people who have diabetes, that relationship actually disappeared completely.
Oh, wow. Okay. So what you're saying is that while it's possibly useful to stratify risk in older patients without diabetes, it may be of limited clinical utility in those with diabetes, who at least were already at significant risk of CVD.
Right, exactly. So I think the bottom line is that it certainly can be used in risk stratification in people with and without metabolic syndrome, but at least our data, which certainly should be actually confirmed by other studies, but at least our data from this large cohort of actually older individuals seems to suggest that actually LV mass is of limited clinical utility, if at all, in people who have diabetes.
And this is in the September issue of JACC Imaging, so please go look at the paper by Hoang et al. And for Cardiol Source World News, I'm Executive Editor Rick McGuire.